Hello, this is Mark Knudsen, Chief Experience Officer at Synzi. Appreciate those of you taking the time to learn a little bit more about Synzi and our virtual care platform. I'm going to walk you through a few different scenarios today, but I think it may be helpful just to start by saying that this our platform, our offering is designed to provide communication and remote care to allow providers and clinicians to communicate with each other, to communicate with patients, their family members, and any other caregivers that may be involved in their care. And you can securely have a unified conversation to ensure that the patient's getting the right care and following the care plan through this platform. And there's a variety of different channels I'm going to demonstrate to you, but one of the compelling pieces is we're designed to facilitate communication everyday devices. So you're going to see on the screen here a web browser. I'll share the screen of an iPhone a little bit later. We run on iOS and Android tablets and phones, as well as across all major web browsers. So with that kind of introduction, let me just start by orienting you to what you see on the screen, which is our virtual care app designed for clinicians to communicate with each other as well as with patients. And just to show you a couple of the basics, let me just initiate a video call here to my colleague Mike, and you can see very quickly how easy it is to get into a video call. There's no codes that need to be texted, no meeting participation IDs. It's as simple as letting the platform handle the routing and make the connection for you. So video calls are a great way to, if you need to demonstrate or put eyes on a patient or something like that. We also support secure messaging. So I can message with a colleague. It looks just like your standard texting apps, messaging apps. And in addition to having a secure conversation back and forth, I can also share images and PDF files. So an easy way to exchange documents or exchange images that in turn can be attached to an EHR or other system of record. One of the things that's fairly unique about Synzi is the ability to interact with individuals across organizations. So it's not necessarily just that you're working with colleagues who may be at different branches or locations, but you can actually also talk to standard partners and their staff. So for example, if I'm a home health agency and I'm regularly getting referrals from this metropolitan hospital you see on the screen, I can video call or secure message with their discharge coordinators so that I've got a way to be in front of them and help drive more referrals. And this cross-organizational piece can work with hospitals, it can work with primary care physicians, specialty physicians, lots of different ways to make that workflow be optimized for your particular needs. From a patient perspective, we are focused again on the communications and really not looking to be a transitional EHR, but really to make sure that we can put care plan information, care assessments, even remote monitoring for patients. So I'm going to walk you through a few of those different pieces. Let me just start by showing you one more piece of this video call. I'm going to call Mike now as a patient. And one of the things that's very nice about Synzi, makes it very convenient for all of the required people to be in the same conversation, is that you can add additional staff through a partnership we have with AMN Stratus Video. You can add a video interpreter if your patient or patient family members are not primarily English speakers. And you can bring in family members or caregivers. So right now I've got another user logged in here, and I'm going to bring them in. You can see how easy it is to bring in 3 people into a call. So lots of convenience with the video piece that we offer. And just like I showed you the secure messaging with staff, I can also secure message with patients. And as I mentioned earlier, you can share a image. So one of the things that Cinzy has had a lot of success with our partners is being able to facilitate wound care over a distance. So even if you have, despite the pandemic, the ability for nurses to get into the patient home on a regular basis, there's still the need to monitor, or potentially the need to monitor how that wound is healing and progressing, making sure that the care is being managed, and the ability for a patient to just snap a photo and share that on the secure message thread, then be able to add that photo to the EHR chart makes it very convenient for interacting with patients and making sure that their care needs are met. One of the things that we've introduced recently is remote patient monitoring, and focus specifically on monitoring vital signs. So blood pressure, pulse oxygen, heart rate, temperature, and weight are the key things that we work to capture. I'll show you how this looks from the patient perspective in a little bit, but we focus, just like we want to run on consumer devices for these communications, we really are focused on the consumer market from a remote monitoring perspective. We want the devices to be easy to get to and cost effective. We don't want proprietary hardware. We don't want this to be an expensive endeavor. So we've standardized on Bluetooth low energy devices that report on these vitals, and certainly would be happy to follow up to share more about how this works. One of the things that we do, in addition to capturing these vitals, pulling them through for reporting, making these vital data points available for use in other systems, is we also allow alerting. So you can set a threshold for day over day or reading over reading changes and generate alerts. So as you can see here, we've got alerts generated for the blood pressure and for the weight change, which is a great way for proactively getting in front of client needs and not having to react to care emergencies all of the time, but being able to actually be aware of a patient's needs more or less in real time, interact with that patient and provide quicker care and hopefully avoid emergent situations. We do that same alerting with assessments. So you can see here I've got a recurring CHF assessment assigned to this patient. The patient responded to this most recent instance of the assessment, and I could see alerts here generated indicating both the question that was responded to, what the answer was that generated the alert, and then from here I've got the ability to interact with this patient where maybe I want to give them a call. I can also send a secure message to check in and see how they're doing, or if I've interacted with them in some other capacity, I can indicate that the situation was resolved and that that resolution is going to take place and be noticed both in the reporting as well as removing that flag from the patient themselves. So lots of different options available for communicating with patients. And the idea is to use whichever communication channel is appropriate for the care at the time of need, so that that patient again is being communicated with. There's not gaps in that care, and they're not going to an ER because they're anxious or have a question, potentially resulting in a readmission. So at this point, let me switch over and start to show you the patient view. I'm just going to mirror my phone here real quick. All right, so one of the things that Cinzy does is it allows patients to interact on video calls without any sort of app needing to be installed. So you see here, let me just put up a background that's a little less distracting. So here you see a text message that's gone out to a patient. We're viewing the screen of an iPhone, and it's what we call click to call. So a staff member has basically reached out to a patient, indicated that a video visit would be helpful. And so all that patient has to do is click a link. They'll be brought into the browser that is on their mobile device. They click the join call button, and now we're routing a call out to the staff member that initiated this call. They'll just be prompted to allow camera and microphone, at which point, as simple as that, they're now in a video call for care being provided. And there's no app. It's as simple as that. So we're very much focused here at Synzi at trying to make the patient experience as simple as possible, remove any barriers that might be present for that patient to get their needs met. Now, there is some richer functionality available if the patient does install a mobile app on their device. And that's what you're seeing here. We call it the Care Connect app. And it really lets patients connect with their care teams across automated education and reminders, to share remote device readings, to take assessments, and to do a video call or a secure message with a care team member as needed. What you see right here is the home screen, which is basically a list of reminders and items that a patient needs to pay attention to. So in this case, we see that the patient has been requested to do a remote reading for oxygen level. So I've got a Bluetooth oxygen device here that I'm going to put on my finger. And so as the device is paired, getting a reading is as simple as having that device on, and then taking a reading for that. So other things that you can do on the Care Connect app is you can contact a care team member. So there's the ability to do video calling like we've demonstrated, secure messaging like we've demonstrated, and even an on-call type of situation where you may have rotating staff. And so we call it first available calling, where basically the platform will connect that patient with the first staff member that's available to meet their needs. And from an assessment perspective, we saw what that looked like on the staff perspective. This is what it looks like for a patient. It's very simple, just a standard web type survey that they can respond to very quickly, very easily, and submit that. And now you've got structured data and potentially alerts generated as needed. So very simple experience for the patient. We've kept it that way on purpose, but it starts to generate a lot of data. And that data is very valuable for monitoring care at any given moment, as well as monitoring care over time. So let me spend a few minutes walking you through some of the reports that the Synzi platform makes available. What we're looking at right here is the detailed contact report. And this is going to give you specific information around your organization, users defined within the organization, and activity that's taking place. So when it comes to these video meetings, and we've seen examples of a couple of them today, the details of that meeting are captured and can be attached manually or even automatically to the patient chart, depending on what EHR you're using. And there's details like what date the meeting occurred, the start and stop time, who the participants were, and how long they were on that call for. So you've got all of the details of who participated in that conversation, so that you can record that as a record. And certainly if you've got physicians in many cases, that's going to be a reimbursable encounter. We also capture all of the details for any outbound content. So if you're sending education or reminders as part of a program, you can see who the target patient is, You've got identifying information so you can cross-reference activity in Cinzy with your system of record like an EHR. And you've got a date and time stamp as well as a destination target for where the content was sent, the details about the content. So you've got a full audit trail for any outbound content that is going to patients, which is very helpful should you ever be asked to look up a particular interaction with a patient. One of the things I'll highlight here in this report is that Cinzy supports multiple languages or translations of any educational content. So if you've got pockets of your population that are speaking Spanish or Mandarin or Vietnamese or another language, you can share the same content with your entire population and based on configurable settings, have the content go out in the preferred language of the patient, which there's a number of peer-reviewed studies out there showing really the uptake in adoption and follow through on care plans for individuals who are not primarily English speakers when they can receive that post-acute care instruction in their native language. So lots of options here for capturing different detail. So other reports that get generated, we looked at the remote monitoring interventions, and basically you can see here we've had some flags, and we've had a previous reading and we've had a current reading indicating both the change in values as well as what is generating this alert. In this case here, I've got the actions resolved, but should there be an open intervention, I can follow with that patient from an administrative perspective via secure messaging or going through the virtual care app with a video call if more appropriate. So again, this allows you to generate a proactive queue where you've got a sense of what's happening with a given patient population, where these remote monitor readings may be raising concerns, and you can triage based on really a priority here of who may be generating concern and need more timely follow-up. Other aspects of the remote monitoring is the ability to track over time. So again, we've got different vitals associated with a patient. For this patient, there are the blood pressure, heart rate, oxygen, and weight. And you can see the tracking over time. If you've got a patient who really needs to take readings a couple of times a day, it'll track multiple readings over the course of a given time. And we've had a number of clients who've really found this very helpful. I think most of the solutions in the market to date have been proprietary hardware, potentially having to purchase or lease a device for the monitoring, potentially a mobile device for the app to facilitate the interaction. The feedback has been that Cinzy offers a very cost-effective alternative, potentially allowing you to either replace what you're doing for your high-risk patients or for a broader set of patients that maybe are at risk, but a lower level risk, that the level of investment for monitoring those patients is now actually achievable as opposed to cost prohibitive. The assessment interventions that we talked about before from a patient and a staff perspective also generate similar interventions. So we looked at that CHF example earlier, and here you can see what an intervention queue might look like from an assessment perspective, where we've got some resolved issues based on the date range I'm looking at, but I've also got an open issue that I can either mark as resolved because I know I've talked to Chandra, or I can secure a message with her from this console to do any follow-up. And we capture the assessment information at an aggregate level as well. So depending on what your needs are, perhaps it's trying to understand population behavior or engagement, or even health metrics over time. You can start to see an aggregate level how people are responding. And you can also be looking at response rates if you're looking at engagement with the patient and the services that you may be providing to them. Again, it's a structured format, so lots of ways to take this data outside the Cinzy system with any type of data analytics tool and really start to look at behavior over time, which can be very powerful. And the last thing I want to show you before we look and see if there's any questions is something that we've introduced based on our clients asking, and it's return to work functionality, where we can, for a given client, for their staff, provide a daily survey that is asking about health symptoms. And whether your staff is going into an office or potentially going out to patient residences, you can have them do a structured survey where they respond to questions around their health. And just like we saw before, generate alerts if need be. And you can track over time which individuals are responding, which are generating alerts, and which are completing this return to work assessment successfully without any concerns. So it's proven very effective in our client base for making sure that they've got coverage for any shifts that may need some backfill based on staff availability. It's also been very helpful with audits. So just last week, we had one of our clients operates in Texas, which is one of the stricter states from a state auditing perspective, where they got a call, they got an audit. They were basically, Texas was making sure this agency was monitoring and had data tracking for the health of their staff. And they showed them the Cinzy reporting, and it met all of their concerns. So it was a very big help, not only in managing the care staff day to day, but in having that data available from an audit perspective.